Good morning, everyone. Thank you for having me here. Thank you, Dr. Momartz, for having me come all this way from United States. I want to talk about fat transfer today, some more soft tissue than hard tissue, and it's going to be teaching you today how to see differently than what you may be accustomed to looking at. It's going to be mainly focused on the soft tissue envelope instead of the deeper bony structures. So let's take a look at aging. Let's take a look at 20 years of aging of someone in her 20s and her 40s and ask yourself the question, what's going on here? Have the brows fallen down? Have the cheeks gravitationally fallen? Has the jawline fallen? And what you're going to look at is if you look at the brows and compare them, they haven't moved. And if you look at the skin has maybe come down about 1 millimeter on the left or the right, but really has gone up a little bit on the left. So there really is no gravitational component whatsoever. So we tend to blame gravity in our 40s and 50s, and we pull up a little bit and we think that that's the problem. But if you look at it, all it is exposure of bone around the eyes, the cheeks, and the chin. So there's just more bone exposure. There's loss of the soft tissue envelope. Let's take a narrower time gap, let's say from early to late 30s, and ask yourself, there's something different there, right? The person looks more tired, doesn't look as fresh, as feminine, as attractive, but what is it? You think it's gravitational, but look very, very closely around the eyes. It's just more of the orbital rim exposed. It's more of the cheek bone exposed. It's more of the chin bone exposed. It's all just exposure of bone. So how is a way that we can communicate with our patients? I think a huge thing is being able to communicate with our patients. So I use a model of a glass of water. So I look at this, and we'll talk about that in a moment, as ongoing volumetric loss of the face from birth to death. That's all aging is. I mean, yes, there are wrinkles, yes, there's some gravity, yes, there's some bone loss, but principally, to make it a very reductionist perspective, it's about volume loss from birth till death. Well, if that's the case, what I find is oftentimes when I speak with women, I ask them, when do you think you look the best? They don't tell me 20. They tell me 32 or so, because there's too much volume almost in youth. And so it's about understanding that too much volume is not good. And I'm going to talk more about methodology on my master class on Friday. Today it's more about teaching you how to see differently. So the way I communicate is I don't fill too much fat. I just put just enough to make a big difference in the face, and I do a little bit everywhere because it's not just the eyes, it's not just the cheeks. It's a lot of little places that have aged, and again, that's going to be something more on my Friday class to tell you how I actually execute on this. So if we're going to talk about big picture thinking today, I want to talk to you about Malcolm Gladwell's concept of blink. Blink means you look at someone and instantaneously from about 20 feet you can tell they're young, attractive, or older, even before you see a wrinkle. Why is that? Why is that the case? It's because of the shape. So as surgeons, as physicians, we get too darn close to the face and we get really microscopic and get focused on methodology, and we can't see the forest from the trees. So my goal is to take you back a step and see the big picture. So how do we see aging? Well, you see a child, you instantaneously know it's a child, even if you don't look at the wardrobe or the height. It's the facial shape that gives it away. We start with a circle. As we continue into the teenage years, it still is a very robust circle. No matter how thin you are, it's still round in configuration. Into the early 20s, it's still circular. It's still very, very full face. And as we mature into the mid-20s, it starts to lose a little bit of buccal fat, not much, and it starts to turn into a triangle. And as we get into the late 20s, there's a little bit of more suppression to the outside portion of the face where we become more triangular, almost a hybrid between a triangle and a circle. As we get into the early to mid-30s, there's more suppression, and there's more suppression in the buccal area, more flattening of the cheek, and most women actually prefer this more sculpted appearance. As we get into the late 30s to early 40s, before even wrinkles could set in or visible at 20 feet, our face starts to flatten, the jawline starts to become thicker in certain areas, and it looks more squared off. And this is the beginning of the dominance of the lower face. So we start to invert that triangle, where the lower triangle becomes more and more accentuated as the upper face begins to be more hollower and hollower. And as we become totally vacuous in our upper face, there is a very strong dominance to the lower facial attributes, especially with metabolic slowdown and possibly with greater weight gain as we start having predominance in our lower face. So initially I thought, well, an easy way to interpret this is just to flip the triangle, bring back to heart-shaped face. But I've added a little bit of subtlety to this, which is to think about the buccal area being very important to create a little bit of volume in the right candidates. And I'll show you some examples to have you understand this more concretely. So we're going to talk about creating ovals. And if anything I can get across from here is understanding artistry. Now, I like the ASMS, the artists of the face, or that idea of just thinking of ourselves less as technicians and more as artists. And so my goal is to create facial balance so the face looks good. Here's a lady that if you look at her, she's got relatively strong cheekbones. And if I put a lot of volume out here, she would look very cheeky. It wouldn't look good. So I sculpted the anterior cheek and blended it into the buccal area, of course anterior chin, and I blended it to create more of an oval shape to the face. The one thing that I want to teach you to see in the mandible, the lower face, is not to see the jawbone, but to see the exposure like an upside down U of volumetric loss across the front of the chin and into the prejowl sulcus, right in this area. And if you look at all my work, you'll start seeing that area nicely filled out with fat. And we'll talk more about that coming up on Friday. So here's a lady that looks almost too wide in the lower face, the upside down triangle, and bringing back the volume to the central cheek across the chin area brings her back and actually thins her face, which is obviously a great fear that fat will widen your face, and it doesn't necessarily have to. Here's an example of no liposuction or facelift, but adding volume targeted toward the anterior chin, prejowl, and anterior cheek, and it brings the face actually narrower in scope, which is another way to sculpt with fat. This is a lady that's too bony at 41, too narrow. So if I add a little volume to the outside portion, it starts to create a more blended look. So this is lateral buccal and central buccal area to unify the face. So it doesn't just look like a cheek, but it blends very, very well. I'm sorry for a little bit more makeup on the after photograph. But if you look, it's about volume around the brow, it's volume under the eyes, it's volume to the cheek, a little bit to the central buccal only to widen that area and provide a good blending. And then of course anterior chin and of course the prejowl just finishing the picture. But there was no blepharoplasty, no brow lifts, no facelifts. I want to take these two twins in a moment to have you understand how we read aging. I want you to focus for a moment on the small photograph. Look at the two women there. The woman on the right probably looks a lot younger to you, hopefully you can see that, than the woman on the left. But they're twins, they're identical twins. Well, why is that the case? Because if you look at what's going on, it's the volume of the brow that I refilled. This is about 3 years out from fat, under the eyes, into the anterior cheek, and you see the boniness of her identical twin sister on the left, and it just needs a little filling of the chin and blending the face back in. The photo of the before and after is at 37 and 42, where I did her fat transfer around 38, 39 years of age. Let's take a look back when she was 30, and you can see the way that you emotionally relate to her on the photo with her twin, similar to the way you emotionally relate to her when she was 30, because the volume strikes of balance allows you to sort of see that and say, wow, I can understand her like a 30-year-old, even though she's 42. Light. How does light interact with the face? Something we don't think about. And I really want to challenge you. I've been thinking about this, and sometimes we look like, you know, this American actor Nick Nolte after a bad night. And the idea is, how can we make the light effective for you no matter what situation you're in, if you're outdoors or indoors? Well, think about it. Light comes down from above when we're indoors or outdoors, right? Unless we're at a dressing room of a beautiful high-end boutique, the light is never diffused. It's always coming down harshly on our face, and we never look good. So the goal is to understand that I look at the face like a deflated model instead of gravity. There was a doctor out of Los Angeles that looked at the volume changes over a 20-year time period and matched photographs and showed there was no gravity of the upper mid-face. It's just deflation of the face. So understand that if light looks badly on it and you stretch it back, it's not going to work. You need to rethink about it as volumetrically expanding the face, and then when light interacts with the face, it's gorgeous. It's gorgeous from even 20 feet away. You can see youth even at 20 feet away, and that's why I want you to understand the work, is understanding volume shapes from a good distance, not just close up.